Hi, welcome back to another episode of The Architecture of Health. I'm Deb Voisin, and this week my guest is Debby De Martini. She is a thermographer. Is that how you would call yourself?
Yes, I am a certified clinical thermographer.
And I met Debbie actually at a dance class, but I also was her client when I was going through some health things. So basically, my mother had cancer something like 30 years ago. So starting at 26, my doctors were very, oh, scan, scan, scan. And they would find these lumps and scare me to death. And I would wait a week or two and then we'd do, radiate the crap out of my breast. And then I found it was nothing. So when I learned that thermography wouldn't give me these false alarms and I could actually get some insight into other parts of my body that had precancerous inflammation or any kind of inflammation, actually, I got interested in Debbie's work, and I found a cracked tooth through my scan with her that I was able to then get fixed right away. So Debbie, welcome to
Thank
our
you.
show.
Thank you for having me.
So, what is okay? Tell us just in general, how is it that thermography works? And then how is it different from mainstream mammography and other scans that they're doing?
Yeah, and I think that's a great place to start. Is just to kind of give people an idea of how it's different than what you're familiar with. So most of the, Western medicine tests that you're going to be familiar with, mammograms, ultrasounds, MRIs, CAT scans, those are all tests of anatomy. So what that means is they're literally looking into your body to locate and measure structure. So structure could be, fractures, tears, tumors, calcification. So they're looking for the actual lump. Thermography, it's basically digital infrared medical imaging. We're using a digital infrared camera that takes pictures of your body's emitted heat patterns. And the idea here is that really almost every medical condition is precipitated by an inflammatory response. Your body becomes inflamed and then things will progress. With breast cancer specifically, we are looking for the activity in your breast tissue that would suggest the presence of a lump. So we're not looking for the lump. We're looking for angiogenesis, which is the new developing blood supply or feeder vessel systems that would be feeding the tumor. Additionally, activity like inflammation in the breast tissue, inflamed lymph nodes. There's a bunch of off-gassing that tumors do as they begin to grow. All of those have a very specific heat signature. And so that's one of the nice things about it. Number one, it's totally safe. There's no radiation, no painful compression, nothing's touching your body at all. It's not shooting anything out at you or radiating you. But we can see breast cancer development up to 8 to 10 years earlier than mammography. Yeah, yeah,
Holy cow!
yeah.
It, are there some breast cancers that develop rapidly, though?
There are, and some of that is age dependent and some of it's tumor dependent, right? There's all these different factors, and that's certainly something to consider just generally with someone's health. Everybody's body chemistry is a little bit different. I will tell you, 1 in 8 women get breast cancer, and it doesn't seem to matter if they have family history or not. So that's an interesting kind of paradigm, right? It's like, well, and you're right. Somebody like you who has a family history, it can be tricky. Number one, they typically do start testing you guys earlier than an average person. And here's the problem is that if you have that BRCA gene mutation, and some people get the gene testing done and some people don't, and it's okay either way. If you happen to have that BRCA gene mutation, you are actually more susceptible to the harmful effects of the radiation that a mammogram gives you than someone who doesn't have that BRCA gene. So the unfortunate part is they kind of get the snowball rolling the wrong direction. They're testing those women earlier. They have more cumulative radiation testing over the lifetime of their breasts, and they will get sometimes things triggered as a result of that radiation exposure that might have remained dormant and never done anything in their bodies. So from a clinical perspective, radiation's bad, right? If you look at other countries, they will actually chart your lifelong radiation exposure. And we don't do that here. Think of every chest x-ray, every broken bone, every dental x-ray, mammograms, all of that builds up in your system. And it's a 2% increase in your breast cancer risk per mammogram. So I see women in their 70s and 80s who've had 30, 40 mammograms. Okay. That is a huge breast cancer risk just from the radiation from the mammogram. So I feel like it's kind of like when you know better, we should do better, but that gets into politics and standard of care and those kinds of things. But yeah, it can be really tricky. The radiation is not good for you. There's debate amongst oncologists. If you think about, let's just say you have a breast cancer and you don't know that it's in there. Usually people will get DCIS, which is ductal carcinoma in situ, meaning it's growing in a nice little capsule. It stays in a nice little protective cell. And if you don't know that's in there and you squash it, you can rupture that capsule, which then spreads the cancerous cells to what would have been protective tissue. So yes, radiation is tricky, but the squashing that you receive in a mammogram can also be tricky. And you're right, to answer your question, the long story is there are some tumors that are very aggressive and fast growing. Women that are younger typically have more dense vascular breast tissue. It's a little bit more conducive for rapid tumor growth. And with a mammogram, typically they're not going to start testing people until you're 40 or older. Thermogram, we can do as early as 21, as long as the woman has reached fully through puberty, they're early enough to start getting baselines. And really, the best predictive value of thermography is change over time. It's unique to you. You have a unique thermal fingerprint. The kicker is it should not change over time. So you would be your first indication of something's changing.
Wow, that was so rich. I want to go back to 2% increased likelihood by
Per
2%
mammogram.
every mammogram. And I I remember seeing somewhere something like every mammogram is 500 times more radiation than an x-ray. Is
Yeah,
that
so it's tricky because, and this drives me crazy. I got to be honest. Like, if you watch any drug commercial on TV, the whole commercial, they're rattling on about the side effects and the potential complications. But I don't feel like they do that with mammography. You're right. They'll kind of say that the rads are low. And yes, the rads are low. However, they're clamping your breast in between two plates and they're shooting radiation at it. And unlike your chest x-ray where it just blasts straight through you, right? Very quick, the mammogram plates, the radiation is bouncing around to create the image. So yes, the rads are lower, but the exposure is much longer. So it's actually more like 1,000 times more radiation than a standard chest x-ray, like if you had pneumonia.
wow, that is shocking.
It's
And
a lot.
and and the like you said, it's this self-perpetuating cycle. Then you get nervous. Like my breast tissue is very fibrous, so it's always been kind of lumpy. It always will be. And I started, well, let's see, when was the last time? Maybe 10 years ago. I out of pocket paid $4,000 with quote good insurance because they had to do the main mammogram and then they had to do the follow-up sonogram and then they had to, and yet it was all for nothing. And your thermography immediately showed that there was no
Yep.
change in my breast tissue at all over
Yep.
a couple of years.
Yeah,
Yeah.
mammograms can be tricky that way. Again, it's an anatomical study. So unfortunately, a lump is a lump is a lump. They don't know. It could be a little tissue density. It could be normal tissue for your breast. A lot of people have dense, lumpy breast tissue. It could be a little fibroadenoma. It could be fibrocystic tissue, which is a hormone imbalance that shows up in the breast. And on a mammogram, you're right. A lump is a lump is a lump. And they do kind of, I don't want to say they gaslight, but they do. They kind of pressure people into doing follow-ups that follow the standard of care model. And in many, many cases, it's totally over-treating. Like it's just a normal tissue density for that person. Thermography is able to distinguish between all these different things. Breasts are very tricky little organs. They can do a lot of weird stuff. They like to grow things. They like to be cysty. They like to be dense. They like to change over our reproductive life cycle. So in a standard, woman's life, your breast's going to go through many changes. As we age, they tend to get more fibrofatty and less vascular. So things change even amongst your own tissue. But yeah, knowing that thermography can discern between some of these different conditions. All of these things produce a different amount of heat and a different pattern of heat. And so there's none of this guesswork like, oh no, there's a lump. If it's just a tissue density or, I have patients that have had breast surgeries due to cancer or breast reconstructive surgeries, maybe they have breast reduction or breast implants. All of these things will create scar tissue. Well, on a mammogram, that little tissue density is going to freak everybody out, and it's just a scar tissue. It won't have any thermal activity. We know that. So we're able to discern between a lot of these different things, which, again, for the end user, right, is you're not going through that rigmarole of being freaked out and all the follow-ups that were ending up being unnecessary for most people. I mean, there certainly are circumstances that aren't.
And I like what you're talking about. Yeah, there might be circumstances where if you think about that person who already had the horrifying news that they had a tumor and then they had to get the surgery and then they're even more nervous and then the scar tissue is making them even more nervous. It's nice to know that you could take a step back away from this model of kind of wartime medicine that every lump could be something bad. At the same time, this can be a tool that's used the other way too. Like thermography may go, oh, you actually do need to go into wartime medicine, and this is get to your MD right now.
Right.
So it's not a one size fits all sort of thing. It's earlier and more persistent over time, and here's a question. Well, I mean, we're starting with breasts because to me that's the most obvious immediate use I had for thermography. And while we're on this topic, when I think about the things we didn't know about breasts when my mom had cancer, like I've heard something about the people who don't wear bras or way less restrictive bras, since the lymph can flow more freely to the breast tissue. I heard something about women who don't wear bras ever have the same risk of breast cancer as men.
I think it depends. There's so many factors, right? I don't know if I don't know if it's an accurate statement or not. I haven't heard that. I will tell you though that I do see lymph chain congestion a lot. Like most women have it. And I will tell you that the caveat to that is it is almost always where their bras are, right? So axillary, under armpits. If your bra is doing its job, the bulk of the support it should be providing you as actually in the inframammary region underneath the breast. That's the rib cage. That's where your bra should be supporting your boobs, not by hiking it up on your shoulders. It's underneath. And all of those are on lymph chains, and it does cause lymph congestion.
Stop the presses. I need to know. Yeah. So nothing. So does that mean underwires are good?
I don't like them. No, I'm with you. I would rather someone wear less restrictive, less tight, non-underwire bras. I think that it presses on the lymph and causes them to become congested. They don't drain, and we don't want that. We want the lymph system draining. So anything tight and restrictive. I mean, we see this even in the abdomen, right? When people are wearing tight pants or leggings all the time, there's lymph chains in there. And, think of it as it's a gravity fed system, right? It starts here. You got oral pathology. It's all draining down, which is it affects oral pathology, affects your breast tissue quite a bit. Anything that's going in through your underarms, which is why the deodorants kind of get a bad rap, right? If you look at breast cancer cells, there's typically aluminums and things that are found in our deodorants. So I think it's a multifaceted problem. And doing everything we can to try to mitigate some of that is in our benefit. So like I have pretty large breasts myself, and I saw lots of my patients wearing sports bras that didn't have underwire. And I was like, oh, maybe I can get away with that. And I do. And it's been great. There's some really great bras out there. But yeah, try to stay away from underwires, try to stay away from ill-fitting anything. And let things flow. Yeah.
Especially my poor mom. I wish she knew some of this. She was fairly large breasted, and she wore very supportive bra even to sleep. So, and she always laid on her left side, and she always used certain deodorants. And I'm lucky I know more now than people knew back then, but we're also surrounded by many more toxic things now, whether it's the dyes in our clothing or the preservatives in our food or the aluminum from the chemtrails or whatever. So we need our lymphatic flow to be at its max with, good clean water, and then our body's movement and our so you said up and teeth. That's funny that it was through your thermography scan that I discovered a cracked tooth.
Yeah.
That you're telling me that probably had a lot to do with my future breast health as well, because the
Yeah.
lymph, the drainage
Yep.
from here, when your body's cleaning out, goes through these channels up here, and there are
Yep.
major lymph nodes. Now, speaking about sports bras, though, I had kind of tight ones, and if I made a mistake and wore one all day, or even 2 days, I can't remember, like camping or something where you couldn't shower or something was weird, I would right away start to get a little lump right in my armpit, and I would go, I have cancer. Oh my God. And then I'd remember, oh, it's the sports bra is too
it's choking your
tight.
lymph. Yep. Your lymph isn't
Yeah.
draining. Yeah.
And
Yeah.
on that note, in general, it's funny, we don't want chronic inflammation, but our
Correct.
body gets inflamed temporarily, which is good. So people who are trying to kill inflammation when their body is going through a healing process are actually setting themselves back. I was surprised recently to learn that Tylenol turns off your body's ability to produce the master detox agent glutathione. So when people are like, oh, I want to decrease my inflammation, I'll take glutathione. 2,000 people a year die from just one Tylenol because their liver's already choked up with things, toxins it needs to process. So breast health, I still like wearing bras. I'm not going. I'm not
I
going.
can't pull that. I can't pull that look off, but you know, being mindful about what you're wearing. Don't have underwires. Don't wear stuff that's uncomfortable. You know, if you can get a thicker band, it disperses the pressure a little bit better. And then there's also a lot of things you can do to get your lymph to drain, you know, and that's one of the things that thermography is looking for, right? We can tell the difference between lymph congestion or a particular lymph node or two that are problematic that might be a sign of something else. So we can see the differences in those ways as well. You know, dry brushing the skin is a great way to get lymph to drain. A lot of people have the little rebounder trampolines. Some people are using the vibration plates. And then, of course, there are practitioners that do lymphatic massage that will help drain, but you want your whole lymph system draining everywhere. But that is definitely one of the places it becomes congested.
And we spoke about this a little before we started recording, which is that in the movement paradigm, which is my main way to move lymph, is that the calves are seen as your second heart, because the lymph, like you said, goes down, and to get it back up, lymph doesn't have muscles contracting like a pump like the heart that are sending the blood around. Lymph requires the movement of muscles to be able to bring it back up. And so people who can't walk, it's a huge risk for stagnation of the lymph. And while rebounding is okay, I love when we preserve our own ability to. In fact, one of the best ways to warm up for anything, way better than stretching before you work out, can be very damaging. Holding any stretch for more than 8 seconds before you do a vigorous activity can set you up for injury. But a slight bouncing and shaking that really starts to warm up the fascia and gets the lymph flowing through your whole body. So I'm a big fan of rebounding on the ground, and getting the lymph to move by walking. I walk a ton. So tell me about what kind of patterns have you seen, even outside of the realm of breast health, although you've probably seen a lot more in breast. Just tell me, what are some of the patterns that you see the most often that none of us would ever have a chance to see?
There's so many things, you know. I do breast scanning. Probably 50% of the patients I see are being seen for breasts. And I'd say half of those are breast cancer patients that have either had a recent diagnosis, sometimes they're in progress, have been diagnosed, trying to figure out, you know, how quickly do I need to act? Do I need to act on this right now? It's used in conjunction with traditional Western therapies where they choke tumors off to try to get them to calm down before they surgically intervene. So it can be used for that. In terms of, I'm sorry, I got distracted on the question.
Oh, just any patterns that you see.
Patterns,
but you started giving us this high level that the people that you see, a lot of them are in the realm of breast cancer, breast health.
Yep. But I do upper bodies and full body work as well. And there's over 150 different things that thermography can detect. So dental issues, sinus issues, TMJ, eye, ear issues, the fascia system, which, that's kind of in line with what you do. But we have a saying amongst thermographers that our issues are in our tissues. So past traumas, current traumas, stress reactions, all of these things create inflammation in your fascial tissue system. And I kind of use this analogy for people. Think about if you only got one car, right? Your whole life, that's your car. You'd be out every weekend washing and waxing that thing. You'd be right on target with your oil changes and fluid changes because that car's got to last you your whole life. Your inflammatory response really is like your car's engine light going off. You don't want to ignore that if it's the only car you have, right? This is the only body we have. And I kind of say, like, if you don't take care of your body, you won't have a place to live. So inflammatory process anywhere in the body is a really, really big deal. And I'll tell you, in terms of pattern, I see a lot of misdiagnosed things. So thermography comes in, it kind of fills a clinical gap. It's not an anatomical study. We can see musculoskeletal dysfunction, neurological dysfunction, immune system dysfunction, thyroid gland dysfunction, lymph system dysfunction, fascia and muscular dysfunction, vascular dysfunction. So we can see it all. It's highly, highly sensitive, but it's not necessarily specific. So it's kind of like a good place to start. So we know if there's particular areas of concern that we need to sort of direct you to sort of do some follow-up with. Patterns, metabolic syndrome. I talk about metabolic syndrome all the time. I do scanning, I do medical screenings, but the thing I see over and over and over is metabolic syndrome. And that basically, I kind of use this term as this umbrella term that things like prediabetes, diabetes, high blood pressure, high cholesterol, atherosclerosis, this all falls into this umbrella of metabolic syndrome, which is really just our body's reactive state in conjunction with how your tissues are responding to stress, stimulus, and your diet. So diet is huge. Then you add toxins, right? We're getting toxins from everything. Like you said, our clothes, the carpeting, the car seats in your car off-gassing. All of these things present a toxic load on our body, and it's hard for our bodies to clean those out if they're not already functioning properly.
And to that point, I was
Yeah.
surprised in the healing journey with my son that a body that is minus the nutrients it needs sucks up the bad things because it's desperate. So with like molecular mimicry, if you're low on zinc, for example, your body reaches for the nickel. That could even be causing someone to have a quote nickel allergy because their body is trying to like, I want that so bad. I'm so deprived. And so this idea that, because I know when I just heard my hippie friends decades ago saying, oh, detox, detox, oh, that's tox. And I was like, meh, like stop being so. And then I started to get that way when we started to have a health issue. Oh, get rid of the toxins. But if we never put in enough of the good guys, the bad guys will always be invited back into play. So,
Yep.
and unfortunately, like there has been such upside down advice about the food pyramid. When grains are so doused with glyphosate and Roundup and are some of the most toxic things around. When
Well,
we
and
have,
seed oils, like we're learning a lot about seed oils, and and you're right. The unfortunate part is that the food manufacturers have designed the food to be stable on a shelf. They're gonna look cute in a nice little Lucky Charm box or whatever, and there's almost no nutritional value in the majority of the food that we're all eating. And so you're right, it opens breeding grounds for your bacterium and microorganisms that are in your gut. They are all affected by this, and that's your immune system. Your gut flora and fauna is your immune system. People don't realize sugar paralyzes your immune system for 5 hours after consumption. 5 hours. So, you have your little morning cup of coffee, maybe you have a splash of creamer in it that's got, Coffee Mate vanilla flavored creamer. There's a little bit of paralysis for your immune system. And then you go to work and you have a half a bagel. There's some more paralysis for immune system. So we're in this chronic state of our immune systems being downgraded. We have inflamed guts, which causes proteins to leak out into our system, causing the immune system to be confused. And so I think that that's part of why we're seeing such an uptick in things like, inflammation, prediabetes, autoimmune responses. It's huge. Like this just wasn't a thing. And I get it. Some of it, maybe we just know now that that's what's happening. But there's certainly cause for alarm when you've got children getting diabetes. Like that just wasn't a thing unless they had type 1 diabetes. It just didn't happen. And it's, nowadays they're actually calling Alzheimer's, they're calling it type 3 diabetes. So we have to look at literally, and the Chinese say this, the Chinese have a saying that 100% of what you put in your mouth is either feeding disease or fighting it. And so you have to look at where it starts, right? And so I know it's a lot, and you're right. The food pyramid has been designed to sell food, right? And that's the part I think people have a hard time wrapping their minds around, because we don't want to believe that that's what it is, but that's what it is. And everything you eat affects every system in your body every day, every cell.
Yeah, and the bioavailability of whatever you're eating, that this whole save the planet, go vegan, where if someone's got low stomach acid or low thyroid, they've already got metabolic issues. They aren't
Yep.
going to be able to break down raw kale. So they would much better be served by a nice piece of meat that's grass-fed meat or something
Yes.
else that's highly bioavailable and delivers a payload of multiple
Right.
nutrients. And so
Yep.
at the same time, I was so surprised when my son, we were trying so hard to be healthy, and we would try way too hard to be healthy and then have believed something that was total BS, or at least wasn't right for him. We got much more specific later, but I remember one of the big shockers was brown rice, how he would have a reaction with brown rice and no reaction with white rice. Well, I later learned that outer shell is collecting a lot of toxins, and brown rice is high in arsenic, and we didn't know our well water had a little bit of arsenic in it. So he already was too full of that, and so white rice was a much better choice. And so
Right.
I know now not to get an overly I've learned now to look at food from a metabolic point of view, as how is your body going to convert this, and does it
Yeah.
have enough minerals, like a car needs oil. The minerals and the healthy saturated fats are like the lubricants and the engine fluids that you need to be able to process the food into energy.
Yeah.
Yeah. Well, I've got some hope that hopefully they'll ban glyphosate and GMOs. That would be huge, because I saw maps that showed the autism, ADHD, Alzheimer's, Parkinson's, the chronic disease map was almost exactly the map of where GMOs are allowed. Like
Yep.
it was like spiked was all the countries bright red,
Yep.
US bright red, and then Russia, nope. Russia, some of the European countries. So that's one other thing is to understand that as a community we need to come together, because this is in our rainwater. It gets in our tap water, and even if we had our bunker with the billionaires and could go try to have a purified lifestyle and run away from all of this, no, it's in our rainwater. 40% of all of our rainwater 5 years ago had glyphosate in it, and it's a desiccant. It dries out the mucosal linings of our guts. So even if you're eating beautifully, I heard that this is what I heard a few years ago, I haven't verified it, that even organic wheat, they use glyphosate to dry it out afterwards. So let's get out of our ivory towers and into the trenches, where our whole collective can have better rules about what poisons are allowed.
Yeah. I know it's crazy. And then, I mean, you could take that a step further, right? Like lotions that you put on your skin, sunscreens, right? Like the containers that they put the sunscreen in are phytocarcinogenic. So if you're laying by your pool and you have your sunscreen on the ground next to you and it's getting sun on it, you're leaching carcinogenic chemicals into your sunscreen, and then you put that on your skin. So it's everything. I always tell people, like, in terms of eating, if you can avoid, and this is literally how I perceive it. I've kind of done some eliminatory dieting myself to try to test, because I have some autoimmune stuff. I've got Hashimoto's thyroiditis. So I know that that's a leaky gut issue. I've been trying to work on this stuff. And I literally just don't eat anything if it's in a box or a bag, period.
I love it. I love it.
Yeah. So if you want to reduce inflammation in your body, start with your diet and stress, I mean, we could go into metabolic syndrome a little bit more, right? If you're consuming anything with sugar, it could be a carbohydrate, it could be an apple. Okay. It still has sugar. Your body's going to produce insulin as a mechanism to get that blood sugar down. You can't have that sugar in your blood. And so I always try to kind of equate to people, think of insulin like a fat packing hormone, right? Its job is to go get the glucose out of your bloodstream, and it'll pack it anywhere it can. It in the pancreas, in the liver, in your visceral organs, it'll pack it wherever it needs to be to try to get it out of your system. And again, everything we're doing all day long is like that little bit of coffee mate creamer, or your little half a bagel, or you had a little piece of pizza. Anything that's carbs, you're just going to be, your body's trying to get rid of it. You're packing fat. And so we're all running around, insulin resistant, super high insulin levels. All of that also causes inflammation. So we're just like precipitating this massive, explosion of inflammation in our bodies, really is what it is. Yeah.
So those are the two main areas you see these patterns in, and a lot of things fall under metabolic disease.
A lot of them do. And, just talking about the recent years we've had COVID and vaccines and those kinds of things, right? Everybody's system is different. Some people have reacted poorly to those diseases and vaccines, and some people didn't. And it kind of goes back to body chemistry, right? Like what works for your son, he can't have the brown rice. It causes problems for him. And for me, I can't have nightshade vegetables. Like nightshade vegetables are healthy. I can't tolerate them. So it depends on the individual composition of the person. But being aware of that and kind of trying to start fresh, get yourself whittled way down, eat very specific, like you said, grass-fed beef. It's almost like an elimination diet. Like if you go into an allergist and they say, we're going to put you on an elimination diet, they're going to take away everything. And they're going to go back to the basics. Well, the basics is meat. Okay. You don't react to meat. And so we're going to end up, as you reintroduce things, paying very close attention to what is causing you to flare up and what's not. And what it causes your husband to flare up may not cause you to flare up, or your child. And so everybody's individual composition plays a role in that.
I have one other funny story about my thermography experience, which is I had done a 10-day master cleanse, the lemonade diet with cayenne, maple, lemon. And there I was 8 or 9 days in. I had lost 1 pound. My husband at the time had lost 12 pounds. On the 10th day, I decided, well, F it. Why
am I doing this?
I was like, what am I doing? So I drank some bone broth with lots of salt in it, even though I'd been having salt every day, but the bone broth had some minerals in it that my body had been just waiting for.
Craving,
and
yeah.
I drank that and lost 9 pounds in 1 day because my body was so desperate for those minerals. It wasn't letting anything out. It was retaining water because It was waiting for the right minerals, because you can't hydrate without minerals. Right. And the interesting thing is, a couple of days later, I had my thermography, and I didn't think to tell my provider at the time and I didn't think to tell you guys, oh, I just finished this 10-day cleanse thing. And when they came back with the results, they were like, you might want to go to the hospital. Your liver, your gallbladder, your thyroid, everything's tanking. You guys, you really, and I was like, oh, I forgot to tell you. But it gave me this insight, wow, Deb, that was harsh. What you just did was hecka harsh. That's not for you. Anybody with the thyroid thing has got to be careful with these, even intermittent fasting, because you're tanking. You're already low on energy, and then you super duper tank it. Your body gets desperate, and you can really spiral in the wrong direction. At least that was my experience. And the interesting thing is, just like you said, my partner, no, he was glowing. He was it was the best thing in the world for him, whatever was going on. But I don't think he had thyroid issues. And thyroid is, a lot of people have thyroid issues.
Yes, I see that across the board. And, there's people don't realize too, like just your weight, right? If you're overweight person, you are increasing your general cancer risk 60% just from being overweight. So getting yourself at a healthy weight is a really big deal for all cancers across the board. And whether it's vaccine related or COVID-19 virus related, we are, I'm not a physician. I'm a certified clinical thermographer, but I share office space with physicians and in multiple states. I do this in more than one state. And I'm telling you guys, across the board, we are seeing a huge uptick in cancer, where there's a huge surge in cancer. People who had previously remissed conditions like MS or Parkinson's, huge flare-ups of all of these things. Which thing is it? Don't know, but it's there. And so we're seeing a population post-COVID or post-vax, whichever way you want to look at it, of very, very ill people, some young even. So you kind of got to look at, again, the toxicity, right? The toxic load that's being created, and whether that's, I get it. Some people are in a vaccinating parameter where their pre-existing conditions put them at a really great risk. It might be worth those people doing it. I don't know, but
well,
yeah.
And I'm glad you're sharing your perspective of what the trends are, because here COVID was very isolating. I don't know that any of us could really tell what was going on. And I had to just count on all these remote relationships with people far away. And then how can, is that real? So I think this ability to be alone and separate, which is very stressful, I think I got very used to that. But then beyond that, I think this idea of being scared of going out or scared of this. And the top correlate for whether people had severe outcomes from that virus was vitamin D. If you have plenty of vitamin D, there are 27 forms you can only get through the sun. So yeah. How much is it that we went into our little phone caves and got all separate and mad from each other? And then, the other question of what you put in a needle. I when my son was tiny, when we were going through this medical crisis right after he was born, $350,000 bill that I mostly fixed with an elimination diet as a breastfeeding mom.
Interesting.
That's why I started this show. They were like, no, it doesn't matter. You're the mom. Nothing you do matters. This is the baby. This is separate. And I was like, no. It's
if you're feeding him, yeah,
like what the mom eats matters to the baby. And the interesting thing, and there were other complications, but that was an awakening where the medical approach, even the best minds at Stanford and the best from Harvard, whatever, came up with a totally wrong solution at a totally wrong price. We only paid $20,000 because we had great insurance, and they only did one unneeded surgery that didn't fix it. So then I later paid a lot for PTSD therapy to undo the trauma caused by them separating my poor little guy from me. But the thing is, I learned, and I learned, but at the time I didn't know how many times they were jabbing him, because we were in a hospital and then out of a hospital. And then, it was just, and the thing is, because my dad had rheumatoid arthritis, his mom had rheumatoid arthritis. I just have this, my mom's side had autoimmune, I've third generation possible autoimmune disease. Right. And so now I know I have a lot of influence over that outcome. And the thing is, I never before learning about my son's extreme environmental sensitivities and stress sensitivities and EMF sensitivities and all these things we had to unwind to get at health, which we have. Thank God we did it. He's a gorgeous 6'2", awesome ground. Oh, it's just, I'm so glad. At the same time, I being in the middle of that mindset, the kind of battlefield medicine mindset of better jab, need another jab just in case you're weak. Well, I never really thought about when we ingest a toxin through our mouth or through our nose or through our skin, it's already gone through several layers of filters before it would ever get to your blood. And when you take anything with a needle and you put it directly in your blood, someone with autoimmune disease needs to be a lot more careful about putting anything directly in their bloodstream, whether it's heroin. Well, I guess vape is almost directly because it's like right up there by your brain. I've heard of people taking one hit off of a nicotine vape and going into seizures. So
Oh
there's
my
so many
gosh.
chemicals. There's so many
Yeah.
chemicals.
Yeah.
So all I'm saying is, regardless of who needed what, I know some people, everybody made their decision and they'll live with that. But that was, if I hadn't had to go the hard way, I would have assumed, because I was susceptible to autoimmune, that I extra needed to poke myself. And then I learned later I extra needed not to.
Yeah,
But
it's kind of interesting. There's a in my intake paperwork, right? Because part of what I do is I do a full medical intake with people, and as a clinician, we had to add on our paperwork for people, have you had a COVID vaccine or booster in the last 4 weeks? And some people don't want to share that information. They don't want to talk about whether they had it or not. But there's a clinical reason that we were asking that question on our paperwork, and still do it today, is that if you've had a COVID vaccine, we need to know which arm it was in, because there was a rash of false positive mammograms after people started receiving that vaccine. And in some ways, it could be a good thing. In some ways, it's bad, right? So what's happening is the affected arm, if you're having a good immune response to your vaccine, it's going to inflame all your axillary and lateral lymph node chain, and it can cause breast lumps. And so that's just like a word to the wise. Like, you need to be aware that it's doing that. So from a thermography perspective, we're asking that question, not because I care whether you've had the vaccine or not, but I need to know that if I'm seeing something abnormal in your breast tissue, that it's not a vaccine reaction, that it's your actual breast issue. So it affects everything.
yeah, okay. So how about the brass tacks
Yeah.
of, do insurance companies, do any of them cover this now? Is it all concierge or straight to the provider? How much does it cost? How often
Yep.
do people need to do it?
Yep. So I offer a variety of services. The initial breast scan is $225. The first year of imaging, we do a 90-day follow-up to establish what we call your baselines. That's is $175 for that. I do an upper body plus breast, which is $325, and I do full body plus breast, which is $525. All of the images are sent for interpreting by a board certified medical doctor. I use a team. There's like 35 doctors in the group that are all trained thermologists. So they're trained to read these. It's very much like if you had an MRI or a CAT scan. Radiologist reads it, writes the report. You receive that same thing with me. I also offer a free follow-up consultation just to go through the report, make sure you understand what it says. Insurance, no. Most companies do not cover it, and it's because Medicare doesn't cover it. And people don't realize Medicare kind of dictates the order by which tests are ordered and what the allowable cost involved with those tests are. They sort of trickles down into all the other insurance companies, and Medicare doesn't cover it. Now, I will tell you, if you have an HSA, like a health savings account, or a flexible spending account, FSA, through your employer, you can use those for thermography. AFLAC actually has some supplemental policies that people have that will cover breast thermography. United Healthcare also will, in some cases, depending on the policy, right? Depends on which program you're involved with their insurance coverage, will also cover, usually for the breast. But typically, no, you don't need a referral. You can self-refer, although I do receive referrals from physicians all the time, but people can self-refer for this service. I take all major credit cards, all the things, but you can use FSA and health savings account.
Good to know. I wonder
Yeah.
if my Christian health share, wonder what because they're pretty good with preventative stuff.
Yeah, and see, that's the whole thing. It's like our medical system, unfortunately, just isn't designed to be preventative at all. And so, think about if they were, right? How much pain and suffering and illness would be avoided, and then the cost associated with all of that. But it's not how the system was designed. Maybe it'll change.
I have some hope that and if you think of it, at the end of the day, anything unsustainable dies. It's not sustainable, that these costs, fixing emergency medicine is so much more expensive than prevention. But at the same time, we've gotten some pretty bad info about prevention as well. That wasn't, even the blue zones were BS. I just found out the people they were referring to in some of the blue zones where the average age was over 100 was counting all these dead people. It was they were pushing the plant first propaganda. So the nice thing is people like us working together, the free media, the independent media is overturning the legacy media that was funded on the backs of so many people getting sick. I hope. Well, Debbie, last thing. How would someone know, like, this is the day? Like, I got to get off my butt and do this. Like, I know mine I was coming back around where my, at the time, bad insurance that was really expensive was getting ready to tell me you're due for another mammogram. And I remembered that the last one cost me something like $4,000. And I was like, I am not spending $4,000. It makes your 225 just look like a big fat nothing burger. The 225 plus the what, 175.
Yeah, 175 for the follow-up. It's funny. I do a lot of public speaking about thermography just to get the word out there. And I'm often asked, like, well, who's a good candidate for thermography, right? Everyone that has a body. I mean, even if you did an upper body or a full body once every 5 years, just to see, is there something going on? Because thermography sensitivity it's extremely sensitive. There's over 64,000 data points of temperature captured in every image. So we're seeing it in a very, very sensitive view. Oftentimes we see what's called subclinical inflammation. The patient isn't symptomatic yet. Let's prevent the forest fire instead of trying to work backwards to put out the raging fire. I have Hashimoto's thyroiditis. I had to start taking medication for my thyroid when my daughter was born 25 years ago. And only 2 years ago, I was finally told, so 23 years, I was finally told that it was Hashimoto's. Well, guess what? Had I known I had an autoimmune condition for the last 23 years, I would have been doing things a lot differently. And so I think that that's part of it, is that people have to advocate for themselves. You've got to do a little bit of digging. I know that some of it's generational, but there was this attitude of doctor knows best, right? Maybe not. I think people need to sort of question things. So any symptoms, if you're having them, think of it again as that car engine light is going off. Okay. You need to get that checked out. If you're having pain, you're having swelling, anything that just feels off, you're feeling tired all the time. All of these are signals that your body is trying to tell you something's awry. So, number one, let's figure out what it is. Number two, let's make sure that what you've been diagnosed with is actually what's going on. Because, I'll tell a quick story. I had one of my very first patients. I was working up in the Pacific Northwest, and she was seen by an acupuncturist who referred her to me for her diabetic neuropathy. So she's having all this pain and burning in her legs. I'm expecting the pain to be neurologically related, which is what neuropathy is. So I clicked the image. I'm expecting a very cold situation. Nerves, when they're cut off, no longer control blood flow to the skin. So nervous system issues show up as cold. So yes, we're looking at heat, but we're not just looking for hot, we're looking for cold. Well, guess what? Her legs were on fire. They were bright, hot red, not cold. She had undiagnosed MS, and she was being treated for diabetic neuropathy. Made sense. She was diabetic. They just assumed that that was what was wrong. So it's like, you can treat that all day. Think of all the, modalities that this woman was trying, and expense and, pain and suffering that she was going through, and they weren't even treating the right thing. So number one, let's figure out what's really going on. Let's make sure you're not misdiagnosed. And that brings up another good point, is thermography is an excellent tool to make sure that whatever treatments and modalities you are doing are affecting things in the way that you're hoping they will. You can use this to monitor treatment effects. Are you getting the benefit from your treatments that you're hoping to be getting? If not, let's tweak things and change things, because ultimately we just want people to be well.
Right. And I love what you're saying there. I learned through going through the things with my son early on, as I got more into going to a naturopath and the chiropractor and the acupuncture, and it got very expensive. And at a certain point, I realized the only tests I would do would be if I was willing to listen to that practitioner's uh, what do you say, their prescription or whatever they were going to tell me to do. So I wasn't going to get tested for ADHD, for example, because I would not take that psychiatrist's ADHD medication. So I wouldn't go that route because I'm not going to buy into your solution. But then, like, when I started to learn there are all these possibilities with herbs and different ways of eating and different environmental stressors, that there are a lot of things you can do there are, and that are not a drug, and that they do align with building an environment for longevity and health. Then thermography is nice because it gives you a window that you can do more, try more gentle interventions. You have this time to try things that don't have to be the emergency medicine route. And so that's really nice to know. And especially the idea of misdiagnosis. Yeah, that hurts when we
It
think.
does. Well, and it's tough, like another patient kind of type that I get are the people who have gone to their doctor because something's wrong. And maybe they've had all the blood work, they've had x-rays, they've had MRIs, and everything's coming back inconclusive. Like, well, we don't know what it is, but we can tell you it's not these things. Thermography is perfect for those people because, again, it's a completely different way of looking at your body. If you don't have an anatomical or structural change, like a lesion or a tear or a lump or a tumor, your anatomical studies are going to come back looking normal. That does not mean you're not in pain. That does not mean you're not having a problem. They're just not seeing it the way that the thermography would. So let's look at it with the right lens, so to speak.
And I love that. In the movement, I would say regenerative movement world, there's a way of looking at the body that is liquid and fascia and more of the connective tissue, and how malleable our structure is, rather than like the corpse-based view of the body that, kind of like our medical system, has to cut specialties up so that they have the right insurance tag. And oh, this is about her nose, but and then they send it all the way to this doctor and then that specialist, and there's not this look. And in fact, one of the biggest things I have to tell people over and over is that wherever the pain shows up has nothing to do with where the solution is. Like, you need to distribute that tension or that inflammation. There's some other process that system wide, in your holistic alignment, in the holistic tension of your body, is where you will find the solution. It's not going to be in that one spot.
Right.
It's a mindset change when we have to understand people were doing their best when they had different tools
Right.
100 years ago.
Yep.
And we might as well get a systemic view of our bodies, our lifestyles, our food, our inflammation. Well, Debbie,
Yes.
let's help people now. Now everybody knows they need to get a scan.
Yeah.
I know.
Everybody that has a body is a good candidate for this.
Over 21, though, you said, right?
For breast, I do see, like, my youngest patient is actually 4 and my oldest is 94. So I see everybody. But for breast specifically, yeah, I want the woman to be completely through their life cycle. The other thing I will note is that it is not good when they are lactating. If someone is lactating, they need to wait 90 days post lactation so that lactation activity calms down and doesn't potentially mask other problems that could be going on. But yeah, I can see people, as long as they can hold still for imaging, I can see children, and I do see children sometimes. So age doesn't really matter unless we're talking about breasts. I want them to be completely mature. They need to have gone completely through their puberty process, so that the breasts have stabilized. And then from that point on, yeah, that can be early 20s can be a good place to start.
And I know geographically that you come to my town because you used to live here,
I
which is
do.
currently Santa Cruz,
Yes.
and you live in New Braunfels,
Yes,
Texas.
I have a clinic in New Braunfels, Texas, which is between Austin and San Antonio. And I also travel to Santa Cruz, California once per quarter to do imaging. So I'm kind of bouncing back and forth.
And then do you have a place for people, a referral network for people who aren't, say, in those driving distance to those?
Yeah, if somebody has a question and they need to figure out like if there's somewhere in the area that they can find, it's thermologyonline.org, I believe is the website. And what it is it's the American College of Clinical Thermology's website, and it'll pull up a state city locator, and you can just plug your city and zip code in, and it'll tell you all of the certified clinical thermographers in your area.
All right. Well, this has been fabulous. I am
Yeah,
so
thanks for
glad.
having me.
I learned so much. I'm the luckiest one here with this show because my guests are so rich with data to help us design health into our lives.
Yes. Yes. We have my tagline for my business is better insight for better outcomes. Let's make sure we're going at this the right way.
Yes, precisely. All right, Debbie. Well, one of these days I'll see you.
I
Coffee
look
shop,
forward to
lunch,
it, Deb.
dance. Maybe we'll dance.
I know. We'll
Maybe
go do
we'll
some
dance.
Zumba.
Okay. Or African dance. One day I'm
I
gonna
like African too. I can do some African. Yes.
there's some in Austin for sure.
Yeah.
Some really good dancers. Okay,
Yes.
well, sooner or later we will be together again. And
I look
thank
forward to it.
you. Bye. Bye.
Bye.